Good afternoon and welcome. My name is Kelly Condon. I'm the program coordinator for the Texas Oncology Foundation. Thank you for joining us for today's presentation. We have Dr. Lampson here with us, and she's going to be discussing life and health after pediatric cancer. Before I hand it over to her, I just want to give you some background about our foundation. The Texas Oncology Foundation is dedicated to providing support to cancer patients in the communities where they live, work, and receive treatment. And our Survive and Thrive programming, such as these webinars or symposiums, are just one of the ways that we are active in both providing resources and providing support in these communities. We also want to give a big thanks to Texas Oncology for their continuous support and partnership for programs like these. Next, I just want to walk through some housekeeping in case you are experiencing any trouble throughout this presentation, such as your slides are not advancing or the window disappears. Most of the time, if you simply close and reopen the webinar window, that'll usually fix the issue. If you are experiencing problems with your audio, the best solution is to call into the webinar and listen over the phone. There is an audio section on your control panel, and if you select phone call, a number that you can use will be provided there. Throughout the presentation, we are going to have a few poll questions, and when a poll question shows up on your screen, you simply select your answer. Once we've collected responses, we will move on, but we're going to go ahead and practice this. And one thing we want to know is who is on this call with us today. So select if you are a survivor or a caregiver, healthcare provider, or maybe you're a healthcare provider and a professional, and a survivor, excuse me. Awesome. So it looks like we have some healthcare professionals and survivors on the phone with us today. That's really exciting. There is a handout provided by our presenter today. If you go to your control panel, again, there's a handout section on there. These are going to be resources from today's presentation, so you can click on this PDF, you can save it to your desktop and use it as references later. It is only going to be available during this presentation, so be sure that you download that while we are on today. Lastly, if you have any questions throughout this presentation, there is a questions tab again on that control panel. We encourage you, leave your comments, leave your questions for our presenter, and at the end of this, we will get to those questions. This webinar is being recorded and the online archive will be available for viewing after this live version. The recording will be sent to everyone in a follow-up email and will also be available on our Texas Oncology Foundation website, which is texasoncologyfoundation.org, under our programs tab, which you'll find along the top, and then it'll be in our Survive and Thrive webinar archive section, which you'll find on the left of that page. Like I mentioned earlier, we are very excited to have Dr. Erin Lampson with us today. She specializes in pediatric hematology oncology at Texas Oncology Medical City, Dallas. Dr. Lampson seeks to provide the best possible care to childhood cancer survivors by educating patients and family on preventative strategies. Dr. Lampson, thank you again for taking this time with us today. We are grateful for your partnership with our foundation and for your participation in this webinar series. So I'm going to hand it over to you now.
Great. Thank you so much for the introduction, and I'm very excited to speak with you all today about my favorite subject, pediatric cancer survivors and survivorship care. So let's go ahead and get started. We're going to be speaking about life and health after one receives a diagnosis of pediatric cancer. And I have no conflicts of interest to disclose today. And we are making great progress with treatment for childhood cancer these days. Greater than 80% of kids diagnosed with cancer will be cured, and this in turn leads to a growing population of survivors. It's amazing to state that the number of childhood cancers in the United States alone today is greater than 400,000 kids and young adults, and the number of survivors is expected to reach approximately 500,000 by the year 2020, which is very exciting. So we're going to break down the talk into 3 different sections. We're first going to discuss preventative measures, detection measures, and then treatment strategies for late effects of therapy. I'm just going to poll the group. Has anybody in the group heard about the term late effects in regard to cancer treatment in the past? If you want to go ahead and answer yes or no. And so now we're going to discuss what is a late effect. So a late effect is a side effect that occurs months to years after cancer treatment has completed. And you can receive late effects based on the treatment you received, such as chemotherapy, radiation, surgery. And these late effects can affect the body or the mind, as we'll discuss in more detail. And interestingly, your chance of developing a late effect after treatment actually increases over time and with age. So it's very important to have regular follow-up with your oncologist or primary care provider and maintain good health habits in the survivorship world as one ages and gets older after treatment. So first, we're going to discuss preventative strategies regarding late effects of therapy. There are several general guidelines that I like to discuss with all of my survivors in clinic, and these general guidelines would apply to any adolescent young adult, but in particular, our pediatric cancer survivors are even more important to discuss, given the toxicities that our patients are exposed to at such a young age. And this includes avoiding smoking and tobacco, protecting skin from too much sun exposure, as we'll get into in more detail later on in the talk, avoiding excessive alcohol consumption to keep our livers nice and healthy, avoiding illegal drugs, of course, maintaining a healthy diet and weight for height. Exercise regularly is very important. Getting your recommended vaccines is also important to keep in mind. Just a poll of the audience, do you or your loved one who is a childhood cancer survivor engage in regular physical activity? And you can choose the choice that fits you best. So we're going to talk a little bit about how important exercise is in preventing late effects after treatment. So regular moderate intensity exercise has been proven to protect against the development of osteoporosis, high blood pressure, diabetes, and cardiovascular disease. And the Center for Disease Control recommends that the optimal amount of exercise per week would be about 150 minutes total. This can be broken down into moderate intensity exercise or more short bursts of vigorous intensity exercise. And I want to discuss a really great study that was done in survivors of Hodgkin's lymphoma looking at cardiovascular late effects in particular. And greater than 1,000 adult Hodgkin's lymphoma survivors were studied in this research trial at 26 different institutions across the United States. They all reported their frequency of exercise. And it was found that patients who vigorously exercised really substantially reduced their incidence of cardiac late effects. It was so significant, in fact, that there was a 50% decrease in the risk of cardiac late effects in those people who got regular exercise. And so I'll review the data with you here. If you want to take a look at the first chart, box A, you can see that the blue line refers to patients who did not meet the recommended amount of exercise per week per the CDC guidelines. The yellow line are those Hodgkin's lymphoma survivors who did achieve goal exercise guidelines by the CDC. And so on the x-axis there on the bottom, you can see that as time goes by after your treatment has completed for Hodgkin's lymphoma, the risk of a cardiovascular event increases. But those patients, as detailed by the yellow line, who had really regular physical activity, dropped their incidence of any cardiovascular late effect in half by 50%, which is really astonishing. And then they broke it down into particular cardiovascular events such as coronary artery disease. And here you can see that those Hodgkin's lymphoma survivors who met the recommended exercise goals, as referred to in the yellow line, compared to those lymphoma survivors who were not able to meet the exercise recommendations, really dropped their incidence of a coronary artery disease event from about 10% to about 5%. And then here, looking at overall congestive heart failure, as an adult, those who were able to meet the recommended exercise guidelines as referred to by the yellow line were at about a 2.5% risk compared to those who exercise regularly were double that. And then again, as you can see at the last box there, in D, those patients who had valve issues with their heart as they aged and were further out from treatment, those who exercised as referred to in the yellow line had a substantially lower risk of having these valve issues after treatment. So exercise does a lot for you. In addition to decreasing cardiovascular late effects, we also have to talk about how exercise can really impact one's psychological burden. So patients who received and exercised about 20 minutes 3 days per week were at a lower prevalence of depression and somatization. So those who had physical manifestations of psychological complaints did a lot better. Patients who had regular exercise also reported better memory, organization, and task completion measures as well. And so overall, those who had regular exercise at least 3 times per week had better physical functioning, general health, and overall vitality. So if there's a goal that is good to make for all of us, exercise is one. And when I'm referring to heart health in our pediatric cancer survivors, I want to also mention that there are particular patients who are at more risk than others. Patients who have received radiation to the chest, or those who have received a specific category of chemotherapy medicines called anthracyclines, which one may remember is a red medication, are at increased risk for the development of cardiovascular disease. So those are the highest risk group. And so in those patients at long-term follow-up appointments, we really concentrate hard on keeping a healthy blood pressure, keeping a healthy weight for age, controlling cholesterol, and screening for diabetes. And our goals at our long-term follow-up appointments are to closely monitor the blood pressure, as well as obtain the recommended screening labs, BMI, healthy weight for height, all according to the Children's Oncology Group long-term follow-up guidelines. The next preventative measure that I want to discuss is dental and eye care. So who do you think is at risk for dental problems after treatment? I'll give you guys a chance to respond. Those who had chemotherapy at a young age, those who received radiation to the head and neck, those who have been treated with chronic steroids, or those who have a history of chronic graft versus host disease associated with transplant. As one may have guessed, the answer is all of the above. All of these patients are at increased risk for dental problems after treatment. And the potential dental problems that I'm referring to is that those patients who have exposure at a young age, those who have had chronic steroid exposure, radiation to the head and neck, may have an increased risk of developing cavities compared to their siblings, delayed loss of teeth, gum issues, altered taste or sensitive teeth, as well as patients who have these treatment exposures as well may develop cataracts as they age. They're at increased risk for glaucoma. And so I recommend all childhood cancer survivors should have a dental checkup every 6 months. And those who have a history of a tumor involving the eye, radiation to the brain or the eye or orbit, or those who have a history of graft versus host disease should really have an annual ophthalmology evaluation so that their eye health can be maintained as well. I always mention to our teenage and adolescent young adult patients that it is critically important to avoid tobacco, especially as a childhood cancer survivor. We all know that smoking harms nearly every organ in the body, and among childhood cancer survivors, smoking poses an increased risk for organ damage that may just exacerbate the treatment exposures that they already have had in their past, including radiation or those who have been exposed to pulmonary toxic chemotherapy. And so I just try to encourage our patients to avoid tobacco use. In addition, patients who smoke are less likely to exercise, studies have found, and we all now know that exercise is an important piece to overall health in our childhood cancer population. So excessive alcohol consumption can lead to cancer, depression, epilepsy, stroke, osteoporosis, and cirrhosis, and survivors are at increased risk for these effects. We want to make sure we keep a healthy liver after treatment and as well as a healthy heart. And so that's why it's important to have alcohol in moderation. The next poll question is, what percentage of childhood cancer survivors less than 18 years of age have reduced bone mineral density? A, 10%, B, 25%, C, 45%, D, 75%, or E, 90%? The answer is 45%. So about half of our childhood cancer survivors deal with early osteopenia. And this is important to know because peak bone mass occurs in the second to third decade of life. And so that's when a lot of our patients are getting their treatment. Treatment during adolescence can disrupt healthy bone formation and then place a patient at increased risk for osteoporosis or fractures later in life. And this is especially important for our survivors who have been exposed to steroids, radiation, methotrexate, or those who have developed growth hormone deficiencies after treatment, which affects your bone health as well. This particular study looked at over 300 childhood cancer survivors compared to 200 healthy children, and they found that the patients who had lower bone mineral density and thinner bones were those who had developed hormone deficiencies after treatment, those who had high TV computer screen time, those who had less physical activity and exercise, and those who had low body mass, because high impact activity can strengthen bones. And so those who are particularly thin or have less exercise tend to have thinner bones as well. So our goals are always to mention increasing physical activity, decreasing screen time, and also at survivorship appointments for those who are at risk for growth hormone deficiencies or endocrine issues. We screen for those problems with labs, and we also are on the lookout for thyroid issues as well in patients who are at risk. Now we're going to move on to discussing detection and screening measures in our survivorship population. So it's important to note that screening is very individualized. One has to take into account the actual cancer diagnosis, the type of treatment that was administered, whether it be surgery, radiation, chemotherapy, or transplant, as well as the age of the patient at the time of their treatment. Other factors that play a role into one's screening recommendations are the patient's gender, ethnicity, genetics, health behavior, and comorbid conditions. And so each long-term follow-up plan is very individualized for the specific patient based on these issues that we have here. And this is a nice graph that details how all the different factors come together to impact outcome in the childhood cancer survivor population. So we start off with the cancer diagnosis, and that in itself provides a certain risk that a patient has as they get older, where the cancer is located and where the treatment exposures lie. And then we take into account the patient's age. So there's different risks involved if you're male or female with regard to what late effects one is more predisposed to, as well as race and ethnicity. We talk about growth and development. So the younger age you are at treatment can play a role in the development of late effects. And then one of the hot topics in cancer survivorship right now is one's genetics and how it plays a role in developing late effects. So just because two patients are treated on the exact same protocol, you really can't predict who is going to end up with late effects over another patient. Patients who are treated on the same protocol have different outcome, and that's why nowadays we're looking a lot at how genetics plays a role and can influence one's risk for the development of late effects. Then we look at the individual cancer treatment that was administered, treatment exposures, and we look at what other health issues the patient had during treatment or after treatment that can impact the development of late effects. Also, access to care. I'm really passionate about our adolescent young adult population and maintaining their access to care and long-term follow-up appointments, because sometimes our patients graduate high school, go on to college, and it can be difficult to maintain good access to their oncologist or their primary care physician during that time. And it's a really critically important time to maintain regular follow-up. So we try to acknowledge that and provide them the best access to the care they need while they're away at school. And then, as we mentioned before, the patient's other associated risk factors like smoking or activity level can play a role in developing late effects. So all these together can contribute to the morbidity and mortality in our childhood cancer survivor population. So all of our long-term follow-up guidelines for childhood cancer are developed by the Children's Oncology Group, which is the national organization that designs our treatment protocols. And every 5 years, they update the long-term follow-up guidelines, and this is what we use to make an individual long-term follow-up plan for each patient when they come to their survivorship appointment. The most recent set of guidelines from the Children's Oncology Group was rolled out in October of 2018, and they did make some adjustments and updated some of the recommendations for screening based on the latest data and research. And this is a way that follow-up care can be standardized across the United States, Canada, and Europe, so that all of our childhood cancer survivors can turn to the same source and have similar long-term follow-up no matter where they live. And as I mentioned before, the screening recommendations are very individualized based on each individual patient and how they were treated for their cancer. And research is now being focused on how genes modify a person's risk for late effects. And this includes how genes can influence the risk for the development of a secondary malignancy, how genes can impact the development of cardiovascular disease, because not all patients develop heart issues after treatment, but there's a subset that do. And it's hard to predict those patients who may develop heart issues after treatment. Also, some patients report having cognitive issues after treatment. However, two patients treated on the exact same protocol may not have the same cognitive issues after treatment. And so, as I mentioned before, we're doing a lot of research on how one specific genes can modify the risk to develop late effects. Endocrine complications is another category that can be variable, and particular risk factors can develop predispose one to develop osteopenia as well. I'm going to touch on 4 main screening categories that can apply to a lot of our childhood cancer survivors: heart disease, hormonal complications, and cognitive effects of therapy, as well as secondary cancers. And so this is a screenshot from the Children's Oncology Group Survivor Guidelines that provides our recommendations for screening echocardiograms after therapy. And what we do is we break it down into anthracycline dose. So that is the type of chemotherapy medicine that one may have been exposed to during treatment. Again, that was typically red medicine. And the oncologist adds up the total dose exposure and puts you in a risk category. Then we take that into consideration with if the patient received any radiation to the chest area. And if a patient did receive radiation to the chest, then we look at the total dose exposure for the radiation. And we use this information combined to provide a recommendation for the frequency of our screening echoes that we recommend after treatment. So the guidelines were recently updated. We used to have some patients getting echoes every year, but the research has shown that that's not necessary. So now, depending on your dose exposure, our recommendations are to have a screening echocardiogram for cardiac screening every 2 to 5 years. Greater than 50% of childhood cancer survivors report at least one endocrine issue after treatment. And this could be thyroid issues, this could be gonadal or reproductive issues. This could also be osteopenia. Those patients who are at most risk for developing hormonal issues after treatment are those who received alkylating agent chemotherapy medicines like cyclophosphamide and ifosfamide, as well as those that have received carboplatin and cisplatin, as well as those who have had radiation to the head, thyroid, or your gonads, your ovaries or testes. Next, I'm going to touch on cognitive late effects of therapy. So some childhood cancer survivors report issues with their thinking after treatment. The most commonly affected domains include potentially processing speed, and that's how quickly one person is able to take in an instruction and carry it out or process a simple instruction. Another domain that can be affected is your visual motor function, and that's your hand-eye coordination. Some survivors report attention issues after treatment, and some report executive functioning issues, and that refers to the ability to execute or carry out a task that was given to them. Working memory is the 5th cognitive domain that is sometimes affected with childhood cancer treatment. That's holding on and retaining to information. And not all childhood cancer survivors deal with cognitive late effects, but during long-term follow-up appointments, I commonly will discuss this with families in regards to school performance or job performance to evaluate if further investigation needs to take place with regard to these issues. Usually, if there are issues present, the first thing we recommend is a formal neuropsychological assessment. And this is conducted by a specialist who does a battery of tests. So certain things like drawing shapes in a certain time frame, connecting dots, memory games, and they're able to pinpoint exactly where the cognitive issues lie, provide a report, and then that report can be utilized at school or at work so that a patient can perform to the best of their ability. And this can also provide school recommendations so that one may receive a 504 plan or an IEP plan when it is necessary. Some patients benefit from ADHD medications, and so if it is indicated, sometimes that's where we need to go. Cognitive behavioral therapy and learning interventions like tutoring after school can be helpful. Social engagement is important, so I always like for our patients to engage with their peers, participate in after-school activities, and this keeps you on your toes. Exercise can also be an important piece to keep your mind healthy and crisp. And mental health screening is also important, which we'll also talk about during the talk today, because patients who have anxiety issues or depression, low mood, that can cloud your thinking. The last thing I'll touch on today with screening is in regard to secondary cancers. So I don't want to dwell on it too much to bring down the mood, but after treatment for childhood cancer, we usually administer strong medications during a time of growth and development, in addition to potential radiation exposure. And these treatments can place one at risk for developing a secondary cancer as they get older, whether it be a secondary leukemia, a skin cancer, or breast cancer. These are the reasons why it's important to maintain long-term follow-up and never drop off the map from long-term care. Usually, to screen for secondary malignancies, this includes completing a history with the patient and a good physical exam, a skin exam, thyroid exam, getting a family history to see what is the incidence of cancer in this family. If many family members have a history of cancer, there could be a cancer predisposition syndrome that we need to be aware of. Also, getting a basic blood count helps screen for secondary leukemia. I'm going to throw out a poll question now. So patients with radiation exposure to the abdomen, pelvis, or spine need what type of additional screening? X-rays, CT scans, colonoscopies, or screening blood sugars? The answer is colonoscopies. So patients who receive radiation to the abdomen, pelvis, or spine need screening colonoscopies as they get older. This screening begins at around age 35 or 10 years after their radiation exposure, whichever occurs later. In the latest Children's Oncology Group guidelines, in an effort to try to help with feasibility of this recommendation, they also provided an option for fecal occult blood tests, so looking for blood in the stool as opposed to colonoscopies. But if a survivor doesn't really want to get a colonoscopy, there's alternative screening recommendations that can take place. But if you get a colonoscopy and it's clear, then you don't have to have one for several years more. So that's probably the best test. And then also I want to mention that women who have received radiation to the chest, greater than 20 gray, that's the dose of radiation, we really recommend monthly breast exams as well as early mammograms. So starting at age 25 or 8 years after radiation therapy. Have you ever been taught or are familiar with skin cancer self-screening exams? A lot of magazines have these, and maybe in school they've talked about it before, or with friends. I want to mention that childhood cancer survivors do have an increased rate of skin cancer, particularly those who have been exposed to radiation in the past. Non-melanoma skin cancer accounts for 40% of all the secondary malignancies in childhood cancer survivors. And so patients who have had radiation, I encourage good sunscreen when out in the sun and regular evaluation of moles and abnormal appearances of their skin. If a patient has radiation exposure and a lot of moles to keep track of, I do recommend an annual visit to the dermatologist so that they can have a complete, thorough skin exam to screen for skin cancer. Many survivors struggle with emotional adjustment during the survivorship period. Many do. And this could involve anxiety, depression, post-traumatic stress. Many patients get tearful or sick to their stomach, even coming to the clinic appointment. Patients have a lot of fear of recurrence and emotional distress. And so I really want to recognize this as an issue in our childhood cancer survivors and all cancer survivors in general. I wanted to mention that generalized anxiety disorder can be a common post-treatment effect that we see. And generalized anxiety disorder is 3 of these symptoms most of the time for the past 6 months. So if you notice 3 of these symptoms like restlessness, easily fatigued, difficulty concentrating, increased irritability, muscle tension, or sleep disruptions, it's something to think about and to seek professional guidance on. Major depressive disorder is also commonly seen in our survivorship population, and that includes at least 5 of these symptoms most of the time in the past 2 weeks. So feelings of sadness, loss of interest in most activities, changes in weight or appetite, sleep disruptions, psychomotor slowing, fatigue, feelings of guilt, difficulty concentrating, or suicidal thoughts. So absolutely, I would encourage anyone who feels that they fit into one of these categories to seek help from a medical professional. Ideally, counseling is a great place to start. Physical activity can also be very helpful to lift the mood. Good sleep hygiene, going to bed at a reasonable time, avoiding screen time around the time going to bed can be important. Our next category that we're going to shift on to is talking about long-term follow-up. I'm going to poll the audience. Do you or your loved one regularly see an oncologist or primary care physician for long-term follow-up after cancer treatment? The best defense against all of these late effects that we are discussing here is just going to your survivorship appointment. So ongoing survivor care, whether it be with your oncologist or primary care physician. Usually survivorship care is transitioned to begin approximately 2 years after you're done with therapy and focuses then on monitoring for the late effects and overall wellness. This is why it's so important to keep long-term follow-up. So as you can see on the x-axis on the bottom there, it's the time from your cancer diagnosis, 5, 10, 15, 20 years. And on the y-axis is the prevalence of chronic health conditions. So as one ages and gets further along from their cancer treatment, you can see that the yellow line refers to chronic health conditions. So as one gets older, more chronic health conditions are likely to be developed. And then the blue line shows follow-up to a cancer center. So as time goes by from treatment, you can see that it drops off on the number of patients who maintain regular follow-up with a cancer center or survivorship center, and we need to help fix that. Also, I want to mention that here you can see on the x-axis on the bottom one's age, so at 10, 20, 30, 40 years of age, and then on the y-axis the incidence of chronic health conditions. And survivors are represented by the blue line there, and as survivors age, you can see that the incidence of chronic health conditions rises at a much steeper rate than compared to their siblings, as represented on the yellow line there. And then again, as survivors age, as you can see on the x-axis there, the development of multiple chronic health conditions gets increases in number with time. So as one gets older, the number of health conditions that they develop increases. So that's why it's important to maintain long-term follow-up. At long-term follow-up appointments, you're provided with a cancer treatment summary because all these treatments happened at such a young age, earlier than you can remember. Nobody in their right mind can remember all of the treatment exposures that they received. And so you get the cancer treatment summary that provides all the past treatments, so you can provide it to any subspecialists that you see in the future. You review the past therapies, you review the screening recommendations for your individual situation and treatment for late effects, then are provided with any referrals or coordination of care to make sure that you're getting the long-term follow-up that you need. Also, commonly addressed issues are related to work or school difficulties, providing support for emotional issues of survivors in the family, providing individualized information on reproductive health. And then I also like to coordinate care with a primary care physician. There are some things that we like to do in our office at long-term follow-up appointments. There are some patients that live far away, and some of these things can easily be done with the primary care physician. And so we commonly will coordinate care with the primary care physician to make sure all the needs are being met. I wanted to mention Passport for Care. So Passport for Care is a program developed out of Texas Children's in Houston that's available for childhood cancer survivors, and it's an internet-based tool that each individual treatment institution can put in the information for the childhood cancer survivor regarding their treatment, their exposures, their surgical history, radiation exposures, and you can print it out as a cancer treatment summary. And then that links to the COG survivor guidelines. So all of the recommendations based on your treatment exposures can be linked and printed out so that you know how many echoes you need, how often, and what labs you need when you go to your appointments. So even in patients who then move to another state or provide or establish care with a new primary care physician, if they move on with their lives, this can be accessed and transmitted to whoever may care for the patient. It can be logged in by the patient's oncologist, or the survivor has a portal as well, so they can log in and access their cancer treatment summary and long-term follow-up guidelines. So this program has been really great over the past 10 years or so for our childhood cancer survivors. I have a list of resources here, and this is included on the handout that we provided for you all. And these are some great websites that I recommend if you want to do more reading about childhood cancer survivorship and long-term follow-up guidelines. The Children's Oncology Group is the main one that we use for our long-term follow-up, but also the NCCN, which designs more adult protocols, also have their own set of survivorship recommendations. So the Passport for Care program and website is linked there as well. All these websites provide great information for future reference. And then I have many patients who want to take a break after they're done with treatment and not be involved in any way with anything regarding cancer because they've had enough. But then a lot of times, a few years later, they come back wanting to know how to be involved and how to give back. So I wanted to include some local organizations that do a lot of great things for our patients and for Texas Oncology. And so if you're an individual who likes to stay active and want to be involved, these are some great organizations around the area that provide a lot of awareness and do a lot of great things for our patients going through treatment. Lastly, I want to share with you a video, and this video is actually the story of my younger brother, and it gives you a little insight as to how I became a pediatric oncologist and how I became so passionate about late effects of treatment. So I'll play you the video now.
This is Matt Lamson, a 24-year-old game changer living his dream. I always wanted to be a goalkeeper because growing up, I found out that you get these cool-looking gloves. And so, as superficial as it may be, that's how I started. Lamson protects the net for the Columbus Crew, the MLS soccer team, who play in the very city where he grew up, Columbus, Ohio. Growing up, my father's big soccer fan. He grew up in South America, so he kind of brought that to his children. And then in '96, the city ended up getting a team, and being the soccer fan he was, he brought the whole family out, and it really spurred on my love of soccer. With the gloves and the love of the game, the path to Matt's ultimate dream had begun, but that path would take a terrible turn. The thought of failure and the thought of losing my battle with cancer never even crossed my mind. I never thought about that once. Matt Lamson is a cancer survivor, and at the age of 17, Lamson was diagnosed with Hodgkin's lymphoma, a cancer that attacks the body's tissue. I I was just finishing my senior year, and I went to donate blood to American Red Cross, and they denied me because my hemoglobin wasn't high enough. My father's a physician, so he was struck dumb about that. I mean, why would a 17-year-old kid have blood issues? About a week later, I had the diagnosis.
Fellow crew teammate Chad Barson is also from Columbus. He remembers everyone knowing that Matt would beat this disease.
We knew he was sick and he was going to be battling this, and I mean, Matt is a very perseverant type of person. I think everyone was optimistic, knowing that he was getting great treatment, and just the type of person that Matt is, we all were optimistic that he would be back and better than he was before.
Matt fought the good fight, going through chemo and radiation treatments while his friends went on with their lives.
It was a very difficult time age-wise. Everybody, all my friends went to college. They moved on with their lives, and I was just kind of stuck. I had my family there, so my parents were really there to be the rock for me, and positivity, whether it's scientifically proven or not, really made a difference to me. That's what really gets you through things, is not dwelling on the negatives that you're having to go through each day, but staying positive and really doing the things you love and being with the people you love. As long as they were with me, it wouldn't be an issue, and I would get through it.
And he did. Matt fought for his life and won, something that makes every day after just a little more important.
You want to get the most out of everything that you're doing. It was imperative to me to live my life that way.
I think Matt is back 100%. He's better than he was before. He's healthier than he was before, and just has a better outlook on life.
I try to instill in people that you should really value the time that you have and not waste it. And it's using your second chance of life that you fought so hard to have to actually make a difference.
As for those cool gloves that started it all, nowadays those gloves are more than cool. They are incredibly special.
Lime green is the awareness color for lymphoma. With the help of Adidas, I'm going to be wearing these because I know growing up that I would see goalkeeper gloves that guys would be wearing. I want to know more about them. I want this second chance to really make a difference with everyone that I can.
So I just wanted to end on a positive note because we talk a lot about late effects of therapy and all of these things that can happen as one ages. And I just wanted to let everybody know that the goal is to just get your life back on track and to live it to the fullest. And so knowledge is power, and knowing about late effects and maintaining good long-term follow-up is the best way to maintain a healthy life and lifestyle after completion of therapy. So thank you so much for your attention during this webinar. And if you have any questions or comments, please don't hesitate to submit them, and we'd be happy to hear from you. And I'll turn it back over.
Absolutely. Dr. Lamson, thank you so much.
Yes, of course. It was great.
Yeah, it was very interesting to hear and listen in on, so I appreciate you sharing with us. I actually had a few questions that just came up as I was listening in. Earlier on, when you were talking about dental and eye care issues that might arise and the risk of it, is that something that pediatric patients need to be, I guess, aware of for their lifetime, or is there like an expected time period where they need to be more aware of the risks that might come?
I would say it's a risk more lifetime. So the health of the teeth are going to be aging at a little faster rate if you've had radiation to the mouth or the head or the eye. And so radiation is kind of the biggest risk factor there. But the other gum issues or cavity issues can be lifelong. So that's why it's just good to maintain regular follow-up with a dentist and an eye doctor if you need it.
Absolutely, yeah. And then kind of later on, you were also talking about skincare self-screening. And I know that you shared some diagrams there, but is there any specific areas where survivors need to be more aware of to check?
Yes, that's a great question. So to clarify, the places where I advise skin checks are just in the area of your radiation exposure. So if you had radiation to um, the chest area, if you had it to the spine, the back, where if you had it radiation to the head, the scalp. And sometimes it really requires a teamwork approach with another member of your family, because it's kind of hard to do the skin checks on your own, and it's probably best to involve somebody else in the areas where it's a little hard to see.
Absolutely, yeah. We actually just had another question come in, and it is high cholesterol common for AYA survivors who have had chemo, and is that a warning sign for heart disease?
That's a great question. So I would say in the adolescent young adults, high cholesterol is not common to be directly related to cancer treatment. So I would not say that it is an indicator of like doom to come. I would say that it would be more reflective of current diet or lifestyle issues that we can change in the moment, because I wouldn't expect for that to be an early side effect of therapy. I mention it up there because it can contribute to overall risk as one ages. And so if you come from a family of people who have a high cholesterol and you so happen to inherit some of these predispositions, then getting control of that at a younger age is important, and seeking consultation with either an internist or a cardiologist to get good control of cholesterol at a younger age is what I would recommend. So I don't think the cholesterol would be related to cancer treatment, but it could impact development of late effects down the line if it's not under control early.
Gotcha. Interesting. One more question. So as pediatric patients, I guess like age out or enter adulthood, is this something that you as a pediatric oncologist help them navigate finding the right doctors? And you touched on this like through college years and how they're moving around, but are your offices a good place to reach out as a resource to find that, or what would you recommend?
Yes. So I really like helping patients identify appropriate providers after they are graduated from our clinic. So I see, mostly pediatric, adolescent, young adult patients, and I see them through their mid to late 20s, because I don't want anybody to fall through the cracks when they're moving around the country with college, getting new jobs, insurance issues like that. But
Yes.
for each individual patient, I'll take a look at the case and determine what the risk level is for the development of late effects. If somebody is kind of a moderate to low risk and they don't require that much screening, it may be something that a general good internist can do, a general internal medicine doctor. And so I would then provide the cancer treatment summary with all the recommended long-term follow-up to the patient and the identified internal medicine physician, so that the long-term follow-up doesn't lapse. But if it's a high-risk patient who has a lot of things to deal with, then it's probably good that we maintain regular follow-up with an oncologist who's more familiar with all of the chemotherapy and treatment exposures. And that oncologist could be somebody close to home or somebody in, nearby where they live. And so depending on the patient situation, an oncologist might be a better choice. So usually I'll take each individual patient and try to identify what would be best once they reach their late 20s to early 30s. However, I have seen patients in my celebration clinic, which is my long-term follow-up clinic, for one-time consultations, who had childhood cancer but are now late into adulthood and have never heard anything about late effects or survivorship before. For example, I had a consultation with an elderly woman who was in her 60s, and she came for a one-time visit to talk about late effects because she had been treated for retinoblastoma, which is a kind of eye cancer, as an infant and had radiation to the head as an infant. And when you get radiation in infancy, it can cause a lot of long-term late effects. And this individual had not been taught about it because it was kind of before the development of this field. And so she came, and it was a family visit, and they learned a lot about how treatment as an infant can really explain a lot of the current health problems that she was dealing with. And so I'm happy to provide kind of consult services as well for patients who are older.
Wow. And I also liked the web-based tools that you were talking about, like the Passport for Care, because just like you mentioned in that last case, a lot of them don't remember what was going on when in their pediatric oncology. And so those are really great tools now. So I'm glad you shared those.
Yeah, and the visits, we always talk about the name of the cancer that was diagnosed, and many patients don't really know because they were so young. It wasn't something that was talked about much. So it's important to learn about those things as you get older.
Absolutely. Well, thank you again for just spending this time with us and just sharing. We greatly appreciate it.
Thank you so much, and have a nice evening.
Absolutely. As we bring this to a close, I just want to remind everybody, stay connected with our foundation, visit our website, which again is texasoncologyfoundation.org, and also like us on Facebook. Just to give you a heads up about what's coming up with our foundation, we are going to be continuing our Survive and Thrive symposiums around Texas. And so that fall schedule is being firmed up and will be on our website shortly. So be looking out for those dates. And also continue to join us for upcoming webinars. Next month, July 11th, we will be talking about cancer and the workplace. And then in August, we are going to be discussing fertility options after a cancer treatment. So continue to stay active with us and be looking out for those things. Lastly, please fill out the survey that is going to be emailed to everybody who views this. And so please give us your feedback about the topics covered today and topics that you want to see covered in future webinars. Thank you again and have a great evening.